lives. Is that an accurate thing? Okay. So Dan did his undergraduate work at Oberlin College. He went to graduate school at UCLA in philosophy. What was your graduate in philosophy? Right. I know that he has spent some time at WHO. He was at the University of Wisconsin on their ethics board, I believe, when Jamie Thompson isolated the first line of embryonic stem cells. And Dan has kind of maintained an interest. Dan and I serve on Harvard University's Embryonic Stem Cell Research Oversight Committee. So we had a number of interesting meetings through the years. And he's on a very tight schedule because he worked us into, he's on his way to Princeton to give a talk tonight for somebody who's retiring. So Dan has a very tight schedule. We want to hear from him, and then we want to get him in our group picture before he has to leave. So if you have to leave your lunch at your place so we can do our 1 o'clock picture, just do that. Leave your lunch. Hopefully you're eating with somebody that you don't know. And then you can come back and finish your lunch right after our group photo with Dan. Okay, Dan. If I made any mistakes, let me know.
No. Well, thank you very much, Ann. It's always a pleasure to work with Ann in any capacity, as I'm sure you know. It's really been a joy for decades now. I hang out at the Harvard School of Public Health and teach courses in ethical issues that arise at the population level, mostly in global settings. But in the past, I worked on topics that were closer to the thing I'm talking about tonight. And this is a golden oldie that I'm going to treat you to. In fact, my work on this topic that I'm about to start talking about began in the pre-internet era, and my notes and exhibits and all that stuff, I've got it all, but it's on these media that for which players no longer exist. So I kept it all. I was meticulous. I thought this will come in handy someday, and I've got it all. But in preparing for this talk, I realized it would take me weeks to figure out how to decode any of that stuff. So I'm just going to talk to you. No slides, no pictures. So the story I'm going to tell you about, it's a little self-indulgent in a way. I'm going to tell you about me. You don't know me, most of you, and so you might think, why are we listening to this? I'll also talk about my sister, who you don't know. But I think it's a useful case study. What it's a case study in is moral blindness. I'll jump to my conclusion. My conclusion is you may think that you're aware of the ethical significance of the events that you're involved in. Maybe you think you're ahead of the pack, that you've had special insight into something coming along or something that's controversial, that people argue about, and you know better than other people. So you're very proud of yourself. But listen, it's quite possible you don't know half of it. You may not even know any of it. And that's what happened to us. So we thought we were so smart. I hope we were a little bit, but as we'll see by the end of this talk, boy, did we ever miss the boat. So here's what it is. So what's the story? It all began, my part of this at least, began with a phone call over 40 years ago. My sister, my late sister, unfortunately, my sister Norma was a sociology professor at the University of California, Santa Cruz. And among her specialties was medical sociology. Now, Norma Wikler, she was writing a book, and here's the book. It's called Up Against the Clock, where career women speak on the choice to have children. And I see some women of childbearing age here. You're probably, maybe you have kids, but if not, you may be struggling with the question of should I have a kid and when? Good book. You can get a cheap copy on Amazon now in the used section. And they interviewed 85 women because both of the authors, my sister and her co-author, were career women in their 30s trying to decide whether to have a kid. And one decided yes, one decided no. So it's still the wisdom of their many dozen interviewees in this book. Okay, now I get the phone call. Norma called. She says, Dan, I came across the strangest thing. Okay, what was that? One of the women I interviewed for this book, she decided to have a baby, but she was gay, and there was no chance that a sperm bank was going to inseminator. She didn't know how to have a husband. And she was talking to a friend about it. And the friend said, oh, you don't have to worry about that. And now I'm going to read you a passage from this book. The technique is really very simple. It's just a matter of getting the sperm and inserting it into your vagina. Contrary to what most people think, you don't have to be extra careful about light or air or heat or anything. I heard about a group of lesbian women on the West Coast who are inseminating themselves using a turkey baster. That's right, the kind you keep in your kitchen. I know it sounds a little strange, but I thought it was a wonderful idea, so I used a turkey baster, and there was nothing to it. Now, why was Norma calling me with this piece of news? Because back then, I don't know how many of you are from my era, a few of you, maybe you'll concur or disagree with what I'm about to say. Back then, I thought, and Norma thought, I mean, she was a professor of medical sociology, among other things, that you had to be a doctor to do artificial insemination. If you needed to be inseminated, you went to a fertility specialist, an MD, who would have the expertise needed to do this miraculous thing. And here were these women, the story of this woman who got inseminated. She was talking to a friend about her, how would I ever get inseminated? No doctor would ever inseminate me. And she just picks up the phone and calls somebody, and she says, just a minute. She walks next door and comes back with a drinking glass with some milky stuff in it, and reaches into the drawer in the kitchen, pulls out a turkey baster, says, take this in the other room and you'll get pregnant. And this woman's jaw dropped, but she did it, and soon she was pregnant. So what was this? Now, one of the things that medical sociologists study is something called medicalization. It's how different areas of our lives are taken over by a social process that involves doctors and a lot of other people, and they medicalize the thing. So what does that mean? It means that there's a certain pattern of thinking about cause and effect and certain assignment of responsibilities and their roles, and this whole machinery is placed on that area of life. For example, alcoholism. If we think about it in terms of colloquial terms, someone's a drunk. Okay, but if you medicalize it, well, it's a disease, and that means that the person needs treatment, and there are people who are experts who could treat them, and the whole thing sets in. If you get sick, you go to a doctor signs a piece of paper, and your employer will give you the day off if you've got the right kind of contract. And that's because the doctor has that role, a very important role in giving excuses and so on. So here's an area in which apparently an area of life, this is an insemination thing, that was thoroughly medicalized. But it was a wonderful case study because we found out almost immediately there was really absolutely no technical reason for it. This is in the pre-AIDS era. So anybody could do it. You didn't have to be a doctor to do it. In the end, we actually concluded that it would have been better if lawyers made this a specialty, because if you're going to have a baby this way, you're going to need to take care of some questions about, parentage. And if the lawyer did the insemination, it'd be one-stop shopping. But there was really no reason, we thought at the point, for doctors to be involved. So we thought, all right, let's study this, and we'll use it as a kind of a case study for the process of medicalization. And we hit pay dirt right away. We found out, please forgive me if any of you are founding members of the American Fertility Society, because I'm going to ridicule you. We found that the whole machinery was there. There were the specialists and professional associations, and they had lists of indications and contraindications for insemination, and a code of ethics for inseminators. The whole thing. So what were the indications? There was a long list of them. The indication, every one of them was a cause of male infertility. Those are the indications for insemination. Now notice the fertility doctor had contact only with a woman, and she had to be reproductively healthy for this to work. So there's not a word about any medical condition of hers in that list of indications. It's all this list of causes of male infertility. That seemed awfully strange. And then the contraindications. Well, here we had a great time because they were so bizarre. The doctors had taken it upon themselves to decide which women should not get inseminated. And we could spend the rest of this talk just going down some of the more picturesque elements. Certainly no single women. That was absolutely out. That's contraindicated. There was one doctor who insisted no Catholics. Another one had said a minimum IQ of 120. It's kind of hard to figure out where they got these from, but it's what seemed right to them. And when they got together, the question wasn't, what kind of bullshit is this? They didn't say that. It was, well, that's a good idea, but here's mine. That's what they did. In the end, later on, just to give you a little preview, the American Fertility Society heard what we were doing, and they came to us and said, well, what indications would you put down? And we responded, there's maybe just one. Woman desires to get pregnant by artificial insemination, period. They didn't adopt that for some reason. So this is an easy target. We could have a lot of fun at their expense, and it seemed rather preposterous. And we wrote an article called Turkey Baster Babies, the Demedicalization of Artificial Insemination. And we submitted it to the Millbank Journal, Millbank Quarterly, which was a very lively health policy journal, especially in those days. The editor was very nervous about it because he had a board to answer to. He sent it out to 10 referees. And in the end, he printed it with 3 commentaries. They never print commentaries, but he was watching his back. Later on, just incidentally, I was denied a job one time when I thought I needed to move to a certain city for special reasons, and I was looking for a job. And the president of the university said, "Well, Dan, let's just start this off. There are all these people around the table. Let's start this off. Tell me the title of your last published paper." I said, "I'm not going to lie to you. It was Turkey Baster, et cetera." And I saw the big smiles. That was the end of that. Okay. Otherwise, nothing terrible happened, and we got a lot of people seemed to read it, and it was reprinted and so on. All right, now let's get a little bit more serious, because so far we were sort of yucking it up and, as I say, ridiculing these very serious people. But after a while, we started learning that it wasn't just a bunch of avaricious doctors who were trying to get status and money by doing something that didn't really require doctors to do. There was a reason why doctors were involved, and it was something that the patients valued highly. Because in those days, artificial insemination was seen as a way of helping couples that couldn't produce a child because of male infertility to have a child, and thereby to seem normal without anyone knowing that the guy was infertile. Because somehow the idea was out there that infertility and impotence were the same thing. And so males, a lot of husbands, just had a morbid fear about other people knowing that they were infertile, because it would seem like they weren't really manly and so on. And here with artificial insemination, bingo, you have a baby just like you should. No one knows because doctors keep secrets. And so it was a way of furnishing a reality that couldn't take place normally without anyone being the wiser, except for the doctor, the wife, and the husband. And they did keep it a secret too. So this talk had a bunch of initials at the beginning. It was A.I.D, artificial insemination by donor. But in those days, it was A.I.H. No, I'm sorry, it wasn't actually. In some cases, it was A.I.H when the male actually could not somehow get the sperm into the right place, but he was still fertile. Okay, that was A.I.H. But it was an artificial insemination for the husband in a way, because it was serving that purpose. So the family did value the secrets that the doctors kept. But there was another element too, which came out in some extensive hearings that the Canadian government did in this area with women who've been through this. Some women said that when the doctor inseminated her, it didn't feel like adultery. It felt like we were infertile, and the doctor had this drug that he was going to put in with a syringe and cure our condition. So it was a kind of magical transubstantiation from sperm to drug. And so the sperm was the cure. And because it went in through a doctor's syringe at the hands of a doctor, it felt like getting meds. And so the couple was able to put maximum distance between what was actually happening and the act of adultery, which would have been unthinkable, although logically, she's about to get pregnant with another man's sperm. So that too, this is sort of the magical effect of the doctor's holy robes, which in this case is a white coat. It had this effect on the experience of being inseminated, and that's another medical thing. So it wasn't just doctors grabbing it, but there were many co-conspirators, and it served a lot of mutual needs. So we published all this stuff, and as I say, it made a kind of a splash. We got on Oprah with one of the women who'd done it, which was fun. And then we continued to do investigations at the request of various authorities, including, as I say, the Canadian government, and came to the view eventually that we sort of learned that the word father, we think of that as just a natural biological terms, but it's a title. It's like sir or lord. It's bestowed by a society on somebody for some reasons or because of certain conventions or certain processes. And it's up for grabs. Sometimes it's not clear who's the father. Now, in cases like the ones that many of you deal with, whether everybody's getting it into the act and you can say, biological parts and 6 people, okay, then it's really a mystery. But even when the sourcing is not a mystery, the title father is bestowed only grudgingly. Now, let me tell you about more of these initials. A.I.D, artificial insemination by donor, A.I.H, husband, A.I.V. Well, look, after a while, the practice of artificial insemination used people who sold their sperm. So that's A.I.V is artificial insemination by vendor. Now, what's A.I.P? This was a case that I found in which there was a poor woman who wanted to get pregnant, no husband around. She was getting toward the end of her reproductive years. So she thought, well, I can't afford to go to a fertility doctor. I'll just find somebody and have a roll in the hay. So she approached a guy at the bar who she knew slightly and told him what the deal was. And he said, oh, no, I'm not going to do that because as soon as I do it, you're going to sue me for child support. She said, no, you don't understand how artificial insemination works. You're just a donor, that's all. And so she talked him into it. She got pregnant and immediately sued him for child support, of course. So he didn't want to pay it. So he told the judge, he said, Judge, you know about artificial insemination, right? He said, yeah. He says, well, those donors, they don't pay child support, do they? No. He says, well, that's what I am a donor. It's just in this case, instead of using a syringe, we used a penis. So artificial insemination by penis is what we did. So Of course, the judge said, you're going to have to pay. But if we look at this from a sort of logician's perspective, what the hell? What the plastic, glass, living skin? I mean, what's the difference between it's a vessel to get that one substance into the right place at the right time? Why should it make so much difference? That's a good question. This guy had a point, didn't he? So looking at this, after talking to a lot of lawyers about why we have these laws that absolutely won't allow a woman to make an arrangement like this with a male and put him out of the reach of the law when it comes for child support, it's because it's contrary to state purpose. The state doesn't want to pay child support. And if there's somebody else who they can stick that to, they will. And so with artificial insemination by penis, it doesn't matter what your intention is. You can both agree that he won't have any responsibility, but if there's a need for child support, the woman loses her job and the child's not being adequately cared for, the state's going to make him pay. That's the way it is. Now, they carve out this special exception for artificial insemination by donor that goes in through a syringe, but that was supposed to be for families that had a husband. So this issue would never arise. So with the laws, the statutes that are on the books for artificial insemination by donor for many decades, all assumed that it was all going to be about shoring up a family, making a family like a more normal family, where you have a husband and a wife and kids. And that's this is going to be something that gets them there. They don't have to worry about child support because you got the breadwinner right there. Okay, so we had a good time with this, and now what? Well, actually, we wrote two papers. We wrote this paper, and we wrote another one because we realized there was a remainder here we hadn't really taken up. What about those kids? Here, these women who didn't have husbands were deciding that they would have a kid on their own and raise them without, I mean, the male has the least imaginable role here. So what about this? Now, the anthropologist Malinowski had said that there's a cultural universal that for every child, somebody will be designated the father. In some cultures, it can actually be a female, but somebody's going to be the father. And he had reasons why he thought that was always true. But this is about as close to an exception as there is. And we thought, can we really say it's so great for those kids? Should we be worried about that? We wrestled with it. And then we ran into something called the non-identity problem. May I ask, could anyone tell us what the non-identity problem is? Okay, philosophers worry about this all the time. They have for many years. The man who's generally regarded as the greatest moral philosopher in the last few decades is named Derek Parfit. He died recently, sadly. And Derek Parfit, working on an issue that actually discovered by somebody else named Jan Naverson, Parfit hit upon a set of ethical imponderables that he could not solve, and he was absolutely brilliant, and no one else can solve them either. And that's the non-identity problem. So in a nutshell, it's this: suppose that we have a policy, or we're thinking about an action that affects not only what people are going to be doing in the future, but who these people are. Now, you're in the reproduction business, so you're doing this all the time. What you do results in a certain entity being born rather than a different one that might have been born if you hadn't done what you're doing, if there were going to be any at all. So you affect not only how life is going to go for various people, but also who the people are who are going to be experiencing that. Now, the moral problem here is this. In Parfit's famous case, there's a woman who goes to see a doctor, and she's got some kind of condition or other, and she says, well, I want to have a child. He says, well, okay, if I were you, I would wait 6 months. I'm treating you now. We'll get over your disease, because either the condition or the treatment runs the risk of some birth defects. And she said, no, that doesn't fit with my vacation schedule. So I want to get pregnant right away. And he says, no, you have a much lower chance of birth defects if you just wait 6 months. And she said, doctor, you don't understand something. The kid I would have, even if it has birth defects, that's better than not existing at all. And if I waited, I might have a healthy kid with no health problems at all, but it wouldn't be the same kid. It's not the same kid without the health problem. To be a different kid. So how is that going to be a help to the kid who's born with the birth defects? There's supposed to be a benefit to them that they don't come into existence at all. Instead, I have some other kid. So what's the doctor supposed to say back to that? That's the non-identity problem. And Parfit looked ahead. He thought, the world has a big overpopulation problem. And with the overpopulation problem, we have to do various drastic things to reduce population, he thought at that time. And that's going to affect who exists. Look, if we allow the overpopulation problem just to fester, we have huge numbers of people, but every one of those people can thank the Lord or somebody that they didn't institute population control, because otherwise it wouldn't be there. So they're not going to complain. And that would be true even if we had 100 billion people on this planet, right? And how about with climate change? The things we do for climate change will change who's going to be there. And if we didn't do any of those things, and it got hotter and hotter and hotter, the people who come into existence will say, thank God they didn't do anything about this problem, because otherwise I wouldn't be here, all of which will be true. So he thought, these are really deep, important questions. He got people at the UN and all over the world talking about them. And that was coming up here too. So looking ahead, we thought these kids are being born. What are we going to do about the non-identity problem? I didn't think we solved it. We wrote this paper, but I wouldn't submit it. My sister was really mad at me. I wouldn't say because we didn't solve it. Now, a few years later, 20 years later, there was a plaintiff column in the Washington Post by, it's called My Father Was a Turkey Baster. And it was about a girl who grew up, I don't have to tell you the rest. And she was saying there were many days when she was so angry with her mother for, making her live as a turkey baster. So I wrote to her and I told her it's not an identity problem. We corresponded quite a bit. The conclusion was she said she's going into bioethics. So this hangs around. Now I'm going to get to the punchline because we're out of time, but it is a big punchline. We completely missed the boat. We were morally blind. We thought that this non-identity problem was the big imponderable. What we failed to see was that there was an incredible story here, all right, about these women and having a child on their own and the semen donor fathers. It was the rise of these guys who have 60 kids. There's story after story about this. There's one donor who had 100 kids, and now he's going around meeting all of them. Our son had a girlfriend who had 4 digits tattooed on the back of her neck. That's her donor's number. And because of the rise of the internet DNA registries, all these half siblings have found each other. They have a crash list. They travel around the country and say with their half siblings, they have big conventions of their half siblings. It gets weirder and weirder. And Dove Fox, who's a former student of mine, had a prize-winning podcast on Audible a couple of years ago about a donor who, if you look at his entry in the catalog for the sperm bank, he was, just a superhero, but actually he was schizophrenic and he'd been in prison. He was just lied. The women, some of the women who chose this donor because he looked so great, found out about this. And they went to Dove, who's a lawyer, and asked him to represent. But what was he supposed to represent them for? Did they want to trade their kids in and get a better model? No, they all swore they loved this kid. They wouldn't trade them in for anything in the world. Well, what was their problem? It's a non-identity problem again. And so these fantastical tales of multiple siblinghood, half siblinghood, which are now common. You probably know people who are in this situation. And the fertility doctors who it turns out are using their own sperm, and so there are dozens of little limbs walking around. These stories are now all over the place, and we have a new family formation. We have the woman who decides to have a child on her own. She may be gay, but just as often isn't. And here it is, and here are these kids, and here are these donors, and what the hell now? And the non-identity problem, and we didn't see it. If we thought harder, maybe we could have seen it. There's nothing that happened that was unimaginable back then, but it never occurred to us. And we thought we were so smart. We were ahead of the crowd. We were telling everybody else, boy, you guys, your thinking is so encrusted, and you let us enlighten you. And we totally missed it. So the stuff that you're involved in, you probably have no grasp what the ethical significance and importance of the work you're doing is, as we didn't. And well, I guess that's what makes life interesting.
As you can see, we could chat with Dan for another 2 hours, but I really want us to grab our picture, and then you can come back and finish your lunch and your chat. The picture is all set up right outside of the speakers. Sit in the chairs. Thank you so much, Dan.